Hi, and welcome to another episode of Let's Get FACTSinated, where each week we deliver a healthy shot of science and facts. We do two things on this show. We answer your questions about vaccines and the pandemic, and we learn how to effectively communicate science, because sharing science is how we keep our communities safe. My name is Lucky Tran, and I'm the Managing Director for March for Science. We'd like to start today's show with a message from our friends at the March for Science India.
Friends, the country is going through a very difficult time due to the second wave of pandemic. We see people dying without medical care because sufficient number of hospital beds, oxygen, ventilators, and other things are not available. Actually, this situation was not unexpected. We have seen situations like this appearing in the European countries and many other places. So naturally, it had to be expected in our country also. But unfortunately, many of the predictions of scientists were ignored by the government. Last year, about a year back, in April 2020, important scientists of India from the India March for Science sent a letter giving some very concrete suggestions to the government. But unfortunately, most of these suggestions were not implemented or simply ignored. We had suggested to create an adequate number of COVID beds, at least 3 times what we have now, using the facilities available in the government as well as private hospitals, health centers available in the state, district, and subdivision levels. We suggested turning all stadiums and similar public facilities into COVID hospitals. We suggested creating a very large number of RT-PCR testing centers and contact tracing. And we understand that in order to create a larger number of COVID hospitals, hospital beds, turning stadiums into hospitals, increasing the number of COVID testing facilities, all these require manpower. And so we had suggested that on an emergency measure, additional manpower should be employed and trained in order to do these activities as nurses, as ancillary staff, as testing facility, testing personnel, and so on and so forth. None of these were actually done. We also suggested that when the second wave arrives, we will need a very large amount of oxygen. We will need a larger number of PPE kits. We will need a larger number of ventilators. So we suggested that specific industries should be created in government initiative to produce these on a war footing. We even suggested that very expensive ventilators may not be necessary for simpler cases where there is a need for just oxygen supply for some time, and ambu bags can be used for that purpose. One just had to increase the production of these. But nothing like that was really taken up by the government. We also suggested, in order to have a proper pandemic handling plan, we had to have a good idea about the variants or mutants of the virus that are there in the Indian population. So for that, one had to do genomic sequencing of that virus found in Indian patients on a very large scale, so that we know which variants or which mutants are available here and in what proportion, and we also get to know at what rate they are mutating. This is necessary for any pandemic management system, effective pandemic management system. It was not taken to the scale, done to the scale that was really necessary. We suggested that food and other essential necessities should be provided to the poor people, to the daily wage earners, and to the people in the unorganized sector so that they can afford to stay home. If you do not provide this, they will have to go out just in search of their livelihood. But this was again ignored, not implemented. And all these have aggravated the situation, contributed to the onset of the second wave. We know that all these measures cost money. And so we also had suggested, on behalf of the India March for Science, we had suggested that the money required to implement these suggestions should be taken by levying taxes on the super rich. There are also companies which have made windfall profit utilizing this COVID period. And we suggested that there should be additional taxing on the super rich in order to raise the necessary money. We suggested that the corporate social responsibility CSR funds should be used for this purpose, and we suggested that the PM CARES fund should be utilized fully for this purpose. We see that none of these really have been implemented. The scientists' suggestions have been largely ignored, and this has precipitated the crisis at the present time. Our appeal is, it is yet not too late. Please implement the suggestions that we had made 1 year back and let the people have a relatively easier time through this pandemic. Let Indian people not die out of the present situation. Thank you.
Thank you, Soumitro. And all our love and solidarity goes out to the people of India during this painful time. Friends, what is happening in India and other parts of the world right now is a moral catastrophe. Although things are slowly getting better in some parts of the world, such as the US, the fact is, we are in the worst point of the pandemic so far, with record numbers of cases and deaths globally. This is a moral catastrophe because rich countries like the US are hoarding resources and blocking policies that would help the most vulnerable countries in the world. We need to keep speaking up. Thanks to the advocacy efforts of many, the Biden administration have started to make some commitments to help. But we need to do so much more. We're going to leave some resources in the description on how to help, so please get involved. And we were going to feature more actions on future shows. Remember, the pandemic doesn't end when we as an individual are vaccinated. We must keep fighting for the safety of everyone. Now, for the rest of today's show, I'm going to hand it off to my colleague Rania Batrice, our interim executive director at March for Science. She recently interviewed epidemiologist and former Detroit Health Director, Dr. Abdul El-Sayed.
Welcome back to the March for Science Earth Week Media Zone. I'm Rania Batrice, Interim Executive Director. And of course, one of our focuses of March for Science has been and still is public health, as we've all been navigating our way through this pandemic and now through the vaccine process. We have been coming to you with information from public health experts from all different areas. And today I'm so excited to have a very special guest join us. Dr. Abdul El-Sayed has an absolutely amazing background that we could spend an hour going through. But I'm not going to because we have limited time. But he worked in the Obama administration. He ran for governor of Michigan. Today, though, we're going to zero in on his experience as a physician and epidemiologist. Welcome, Abdul. Thank you so much for joining us.
Thank you so much for having me. Excited to be here.
So we're just going to dive right in. We have a lot of important things to cover. And I just, again, have to thank you for making time to share your knowledge with our audience. But if you could just quickly talk to us a little bit about your background and what got you to this point as one of the most trusted epidemiologists and public health experts out there today.
Yeah, so I grew up in this town just outside Detroit, and my father is an Egyptian immigrant. Both my parents are. I was raised by my father and my stepmother. In most summers, when I was a kid, I'd wind up on an airplane to Alexandria, Egypt, where my family grew up, and I'd spend most of my time with my grandmother. And she was the ninth of 14, raised 6 kids of 8 to whom she gave birth. She epitomized the 10-year life expectancy gap I would travel in those 15 hours. I didn't have the language to express it then, but I could see the difference in health on the faces and the bodies of the people that I was spending time with, people in my own family. But here's the crazy thing. I didn't have to go 15 hours to travel 10 years difference in life expectancy. I could go 15 minutes into the city of Detroit and travel the same life expectancy gap. Understanding that, the causes for it, and what we could do about it is the reason that I went to medicine and ultimately went into public health and public service. I got the opportunity to rebuild the health department in the city of Detroit as health commissioner before running for governor of the state, when I realized that so much of what allows us to have evidence-driven, science-driven leadership at the public service level is our politics. It's about whether or not we dignify and venerate science as a way of making decisions in the world. And we've seen exactly what happens when we fail to do that in the context of this pandemic, and also when we succeed. And so that is what got me interested in medicine and in epidemiology, and ultimately into public health.
And you just set up my next question for you perfectly. We, of course, as you know well and intimately, we've been battling misinformation and disinformation around the pandemic for well over a year now, which, of course, the purveyors of these, I'm just going to say it, these lies have sadly capitalized in all the bad ways on science and research, and the fact that when it comes to a brand new global pandemic, information is released as it's discovered. So we can start with what do we know and what don't we know at this point when it comes to COVID-19?
Well, we know it is an extremely deadly, very serious virus. It emerged somewhere in China. We're not really quite sure exactly how, although most of the evidence points to a zoonotic disease, meaning that it was harbored in some animal and made the jump to humans, either directly or indirectly, maybe through livestock. And then it spreads mainly by aerosol. And that means that, even as I talk to you here, there are tiny little droplets of air coming out of my mouth, which is why the best single thing we can do to prevent transmission of this virus in any circumstance is to wear a mask. And then the second best thing we can do is to get vaccinated. This is a virus, and our immune system can learn to recognize the fingerprints, if you will, of this virus in our bodies. And so a vaccination is a means of showing our immune system those fingerprints before our body ever comes in contact with that virus. And so we're in a position now where in the United States, it's taken 560,000 lives and counting. And abroad, it accounts for about 1/5 of global cases. It has brought our societies to a standstill, as we all well know. And we are on the cusp of being able, hopefully, to get beyond it, because we have safe and effective vaccines that together, alongside masking, can help end this pandemic. The key thing here, though, is that when it comes to vaccines, it's important to recognize that vaccines work in 2 ways. The first is to protect you, the person who's being vaccinated, from the virus. But the second is through what we call herd immunity or community immunity. So that means basically, Rania, if imagine you and I were the only 2 people in the world, right, in this little chat here. If I'm immunized, right, and you and I are together, you can't actually get the disease, even if you're not immunized, because the only possible person you could get it from is me. Now, obviously, the world is a lot bigger than 2 people, but if you were to take that same logic and extend it across the world, what you have is a situation where if you vaccinate enough people, even people who are not vaccinated are protected. And what happens is the spread of the virus collapses and the pandemic ends. And we're hoping that we can get there soon. And what it takes is everybody needs to get vaccinated.
Absolutely. And I do just want to call out, just like you said, but it's worth repeating, even after we get vaccinated, we do need to keep masking up, just for all of the reasons that you so eloquently spelled out. I want to jump over to justice, which is one of the main pillars that we focus on at March for Science. And you spoke to it as far as like your journey into where you are today. And I would just love to get your analysis on why Black and Brown and Indigenous communities have been disproportionately affected by COVID. and what are the steps we can take to address the disparities and advocate for real and true equity?
I really appreciate the question, Rania, because this is why I got into public health and medicine, because not everybody gets access to a long, healthy life. In fact, even before COVID-19, David Satcher, who was the CDC director under Bill Clinton, did a very basic study. He said, how many lives would we save every year if we were able to simply reduce the mortality rate among Black Americans so that it was the same as white Americans? And he estimated we save 85,000 lives. So when we talk about Black Lives Matter, what we're saying is those 85,000 lives who die because of structural systemic racism, their lives matter, and we need to do what we can to save them. And that is a matter of public policy. As an epidemiologist, I know that when you look at a pandemic or an epidemic even, you don't just look at the virus. That's not enough to understand it. You also have to look at the virus, and then coupled with the environment and the host. The host is kind of a funny science name for people who are liable to get infected by the virus. So it's the way that the host, the environment, and the virus interact. And in a lot of ways, to understand this pandemic and the disproportionate burden that it's had on Black and brown people, by the way, 2 to 3 times more likely to be infected or die of COVID-19 if you were Black or brown in this country through the course of the pandemic. But that's about the interaction between the host and the environment. Structural racism we can think of as an environment. It patterns who gets access to a number of basic resources that can be used to protect people from getting ill, whether it's clean air or clean water or a good school or a good job or a safe neighborhood or healthcare benefits or being treated as an equal in a hospital or being discriminated against in a hospital. Systemic racism, it's all of these things together that rob people of color of the basic means of a dignified life in our society. And if you think about it as a part of our unfortunate part of our environment, it's been beating up on a certain number of hosts for a very long time, specifically hosts of color, people of color. In comes the coronavirus. And basically what COVID-19 did, what the coronavirus did, was just found the path that we had lit for it through our structural racism and disproportionately infected people of color, taking more of their lives per capita. And you see the trappings of it in a number of things. I mean, we invented a new word for expendable, right? We've been having a debate about whether or not it was worth paying the lowest income people in our society at least $15 an hour, which, by the way, is less than $30,000 a year for their work. And then in comes COVID-19, and we realized that these people are necessary for the functioning of our society. We named them essential, but really what we've meant is expendable, because that meant that they were choosing between their lives going out in a pandemic and potentially getting ill, or their livelihoods and in their ability to be able to afford a basic meal for their family. So these are the kinds of circumstances that I'm talking about. And who were they most likely to be? Essential workers. They were most likely to be Black and brown in our societies. And so we have to understand that the disproportionate income is a function of the choices that we made even before the pandemic hit us. And if we're serious about addressing it, then it's going to be a function of the choices we make as the pandemic recedes. Are we willing to do the work of rooting out systemic racism, rooting out the ways that we pattern access to good schools and good jobs based on race, rooting out the racism implicit in our healthcare system when low-income people don't get access to the same healthcare, and low-income people are more likely to be Black or brown in our country because of how we pattern access to jobs and access to schools? Are we willing to take on climate change and the recognition that the very same factories that are driving climate change for all of us are most likely to be located in Black and brown communities, therefore polluting children, the lungs of children in those communities? So it's all of these things together, Rania, that we have to understand.
That's so, I mean, you just hit every single nail on the head. I feel like I'm getting whiplash over here, just nodding in agreement. Thank you so much for so clearly laying that out. And I often, I talk about this idea of returning to normal. It makes me makes my head want to explode, because this idea of normal is actually, you know, a romanticized version of the realities that so many people lived with before the coronavirus. So thank you so much for speaking so eloquently on that. And I want to jump over to the vaccine rollout, which thankfully has been ahead of schedule. The Biden administration has done a great job as far as that goes, but we are still seeing spikes across the country, including in your state of Michigan, and other states across the country. So I'd love for you to talk a little bit about what we're seeing and why.
Yeah, unfortunately, we've got a number of dynamics that come together in Michigan that explain why we've been suffering this kind of surge. The first is that we have a lot more of the B117 variant, that UK variant that we know is more transmissible, and some evidence has suggested is also potentially more deadly. And B117 hit Michigan first. Michigan has been the per capita capital of B117 in the country for several months now. But the second point is also that we've had aggressive reopening, and that's a function of public policy. We've got restaurants up to 50% now. Indoor sports are a go in terms of high school and middle school sports, and casinos have been open for some time. And then lastly, I think we are all right to be optimistic about the vaccines, but our optimism shouldn't overtake the number of vaccinations that have actually been deployed. And we know that only about 27% of people have gotten fully vaccinated for COVID-19, far fewer than that number that we need for herd immunity, which is more like 75, 80%. And so because of that over-optimism, because of that aggressive reopening, and because of B117, we've got a perfect storm. The sad thing is, Rania, is that we've got cases increasing in the majority of US states right now because of the same exact dynamics. And so it reminds us that we can't get too far over our skis here. We've got to let the vaccines take their course, let them protect us before we start engaging in the kinds of activities that we know are risky. Because here's the final point here. We know that this virus, it's telling us that it can mutate. And every single newly infected person is an opportunity for this virus to evolve, to take on a set of mutations that could that potentially could allow it to slip our vaccine-mediated immunity. And nobody wants that. So let's make sure that we continue to do the basic things that we need to do to protect ourselves, like wearing a mask, like physical distancing if we're not vaccinated, to get to a point where we've got herd immunity, and finally can get forward to a new normal, right? Now, I like your point that you made about going back to normal is not going to help us. We've got to go forward to a new normal. And there'll come a time where we can get back to the things that we know and love, where we don't have to worry so much about masking. But that time's not here yet. And Michigan should remind us that we've still got a ways to go.
Absolutely. And I mean, I often joke about, feeling sorry for my husband because he gets all the hugs that I would usually give everybody else. But, we all want to get there. Of course we do. But to your point, that's so, so massively important. We're not there yet. So let's continue doing all the things that you laid out and that public health experts are telling us. So this is a big one. And I'm going to tell on myself a little bit. For just a moment. I'm not, usually a vaccine hesitant person, but I was when the vaccines were first starting to come out, and I kept thinking, I'm going to wait. This happened really fast. It made me uncomfortable. I wasn't sure. I am fully vaccinated, thank goodness. And I often say I would do it again. But, there are a lot of folks out there. There's this anti-vaxxer crew that's really taking advantage of misinformation, disinformation, but also just the situation that we're in on how quickly science had to move on this. And I would just love for you to help us understand the truth about these vaccines and when folks should get out there and get their vaccine.
Yeah, well, we know based on clinical trial evidence that these vaccines are safe and effective. And I understand why people are so hesitant. I get it. Because at the end of the day, the cornerstone of good science is that we've got to be skeptical. But the answer to that skepticism is data. And the data is very clear that these are safe and effective. In fact, we just saw last week a pause on the Johnson & Johnson vaccine, not because it's not safe and effective, but because they found 6 cases that could be linked to the vaccine that they wanted to investigate more of a rare form of clotting. And what that tells us is that the system is working. If there were real serious side effects, we would have caught them. And so this should reassure folks that these are safe and effective. And you should get them as soon as you can. Why? because of the point that I made about herd immunity. This pandemic ends when enough people can get vaccinated such that the virus has no more place to go. And every day that we prolong this virus's capacity to jump from person to person, we increase the possibility that the virus can take on a set of mutations that could allow it to become immune to our vaccines. And we don't want that to happen. So I encourage folks to get vaccinated today. Bring your skepticism, right? It's the cornerstone of science, but bring data to your skepticism. And sometimes I see people say, well, I'm going to be skeptical about what the authorities are telling me, but my Uncle Ronnie, right? I'm going to take his Facebook post at face value. Look, just be skeptical about everything. Equal skepticism, right? I want you to be equal opportunity skeptics and bring evidence to answer your skepticism. That's the cornerstone of good science. And if you apply it to these vaccines, they're safe and effective. I got one in both arms, and I'm really thankful for that.
Absolutely. It's such a great point. I appreciate that so much. And to your point about the J&J vaccine, that is science working, right? That is the process working. So thank you so much for naming that as well. And as we close out our conversation today, there's so much going on in the world, these concurrent crises. It's really hard sometimes. Some days are just, it's really tough to find one foot in front of the other and how to keep going. Can you share with me and our audience what is concerning you that you're seeing right now? And also, what is giving you courage?
Yeah, well, I'm in the eye of the storm here. I live in Ann Arbor, Michigan, and I've been watching the cases go up and up and up, and it is really concerning. I'm hearing from a number of my physician colleagues and nurse colleagues about hospitals really filling up, and they're worried that we're going to get to a point where there's just not enough hospital space for the level of need, and that really should be concerning for all of us. But what's giving me optimism is a couple of things. Number one, that the vaccinations really are on the way, and they're working, right? The people who are vaccinated are not getting sick even in the midst of this terrible surge in Michigan. That is good news, and it tells us that we really are on our way. But second is that just stepping back and appreciating how hard of a year this was and how sick of it all of us are, but also some of the things, the unintended consequences that I sometimes like to look at and just say, you know what, you're right, there's always something that you can learn from and grow from. And for me, right, in the lead up to this pandemic, I was on an airplane 35 times in the beginning of 2020 alone. So it was like, 2 months, 35 flights. And I missed my family. And since I have not been on a flight. And that means I wake up every day and the first couple of people I see are the two most favorite people I have in the world, and my daughter and my wife. And so there's real benefit there. And I look at the relationships that have strengthened, obviously relationships that have waned. And I look forward to going back and rebuilding those as we get to have more time with loved ones and friends. But I always try and see the joy even in the worst moments and hold on to that. And the last thing is springing in Michigan, and the spring is lovely, particularly because we have such a hard winter. We've got this beautiful tree that is blooming pink and purple, and it sits right outside of my office. And I look at that tree and I say, you know what? Wouldn't it be great if we were like that tree? And even after a hard winter, we bloomed so beautifully. And so that's my goal in the next in the rest of 2021, I hope.
That's beautiful. Thank you so much, Abdul. I really just cannot thank you enough for joining me today and for all the work that you're doing and your willingness to share, which you have been just really out there every day. And thanks to everyone in our virtual viewing audience for tuning in. We wouldn't be here without you. Stay safe. Please remember, it's going to take all of us. Until next time.